Arlene, tell me a little bit about what your job entails every day.
Wow. So I work inside of Duffy as well as doing outreach. So I meet a lot of new individuals that have been referred by the community, Barnstable PD, BinFin, etc. I try to meet people where they're at and listen to their story and try to make the appropriate referrals to other agencies. Obviously try and get them hooked up with our services here. And to try to make it a little less stressful in telling their story, which I can only imagine must be very difficult.
What are some of the services that Duffy provides the homeless population here in the town of Barnstable?
So we have a medical team. We have a medical assisted treatment program for those who are struggling with addiction. We have a Hep C program, Mothers Do Care, behavioral health, case management, and I'm probably forgetting a lot of the new ones because we're always looking to develop something new that would meet the needs of our people.
So collaboration seems to be the name of the game here through interagencies, from the Barnstable Police Department's Community Impact Unit to Duffy to VinFen. How does Duffy become the center of that for referrals out with some of this population? So it seems that Duffy seems to be a hub in some of these referrals.
Well, I think it's, as Jen said, that we meet once a week to discuss clients that may not be patients here or may not be aware of the services that VinVin and the other agencies provide. So we are really a big part of that because we do offer so many services. So we can sort of find something for everybody to ease them into being into a facility. I'm not sure. It really is the community effort, and I've always been really proud to work at Duffy and on Cape Cod because I know people from Provincetown to Bourne, and we all have great relationships, and it's all about the people and how we can help.
Okay. What goes through your mind when you hear a weather report, either with a major snowstorm or a polar vortex? What goes through your mind when you hear that weather's on the way?
Well, this year we've been fortunate because we had the grant, the cold weather grant. But usually what goes through my mind, do we have enough motel rooms? Is the shelter going to open overflow? And do we have enough money?
When you're thinking about the individuals that might need some of the shelter, we've heard that a lot of them may be the non-compliant out there.
Right.
What's your approach with those individuals to get them into shelter?
Shelter, St. Joseph's, or motels, either or?
Either or.
Just educating them on, respect and dignity. There's a level of, you just have to be the best that you can be. I don't know how else to describe it, but there are rules everywhere. And I do tell people, you've got to maintain, you've got to be polite, no drinking and no drugging in the shelter, or if you're put up in a motel room, this is not a party time. It's a time where we are offering you a safe place to be with support.
Right. How important are these safe places to be to bringing someone who's been homeless or chronically homeless into permanent shelter? How does that work? It seems like it's a very long process.
So there's no permanent shelter at St. Joseph's. I believe it's a 90-day stay with some extensions if you're working on a plan. Okay. And for our motels, that's not permanent. It's as weather conditions, severe, sometimes medical issues as well.
So setting aside some of the emergency shelter, how do you as outreach work with individuals to maybe break that cycle of homelessness and get them into a permanent shelter? What are those steps that individuals need to make or families need to help with?
So the coffee drop-in is a great place to go to meet people, to educate them on what is out there, the programs. And then Duffy has what we call Housing First program, and that's people could be struggling with addiction, untreated mental health, but we all believe that if you have a roof over your head, you'll do better. So we do a lot of education around that. We match the clients to case managers, whether it be VinFin, AIDS Support Group, Duffy, I'm probably leaving someone out, HAC, and all the other agencies that work with this population.
Okay. So it goes with the adage that if you have a place to live, you probably can get employment. Is that
true
correct?
for some? There are some that, for whatever reason, maybe physical disability, mental health issues, so there's always some that may not be able to do full-time, maybe part-time, or maybe some volunteer work as they move along. It's a process.
So this time of year, homelessness usually comes more to the forefront because people think about that as a winter problem. How would you instruct our residents on how they can help this population, and or become educated on the ways that they could possibly help?
Sure. I would go to the Duffy website. It actually has lots of programs. It has data that we've collected over the past few years as to what the actual population of homeless people are in the Cape and in the town of Barnstable. It has a lot of information about educating people why an individual might become homeless. And it could happen in your own family too, So we are a resource for anybody out there who has experienced or who would like to learn more about how they can help. Yeah.
Tell me, in closing, how the formation of the Community Impact Unit has helped the collaborative effort to combat homelessness here in our town.
Well, it's really nice to see a person. I've talked to people at probation for years on the phone, but now I have someone that I can actually look at and we can discuss as a team with everybody else that's at that table. I think there's much more trust now with all the different agencies between the police, probation, Duffy, and that's only it's done a wonderful thing in bringing help to our people. And we're usually all on the same page with, how do we move forward in helping this population.
Any last things that I might not have covered that you want to mention?
I just really am so happy about this collaboration, and it's been for many years, but in the last few years in particular, it's broadened, and it's all for the good of our people, but it's also good for us who work in this field. There's a lot of support, and it's pretty intense at times, so it's really nice to have the support of other agencies, and also in-house as well.
Excellent. Thank you.
You're welcome. Thank you.